Hey everyone, and welcome. Today, we're going to dive into the world of natural remedies for all those super common pregnancy discomforts. We'll be looking at options that are safe, effective, and actually backed by evidence. All things you can try at home, based on expert advice. Okay, let's just jump right in with something that is absolutely crucial. This quote you see here, it comes from a physician assistant who specializes in women's health. And honestly, it's the foundation for everything we're about to talk about. I mean, think about it. Poison ivy is natural, right? So we're going to use this idea as our guide. Natural does not automatically mean safe. And before we even start building our toolkit of remedies, we have to be crystal clear about this. Think of these natural ideas as a helpful, supportive layer, but they are never, ever a substitute for your doctor's advice. If something feels off or your symptoms are getting worse, your provider is always your first call. Always. All right, first up on our list, nausea and heartburn. Let's start with nausea because let's be real. It's one of the biggest reasons people start looking for natural options in the first place. So if you're dealing with that queasy, just unsettled stomach feeling all the time, you are definitely not alone. But the good news is there are actually several well-studied options that don't involve medication that you can check out. And what's really interesting here is just how different these approaches are. You've got the classics, right? Like ginger and peppermint. Then there's a straightforward supplement like vitamin B6. And there's even this simple trick they use in hospitals, just sniffing an alcohol swab. It sounds weird, but it can actually interrupt that nausea signal going to your brain. Okay, so let's take a closer look at this P6 acupressure thing. Studies have actually shown it can really help with mild to moderate nausea. It's super simple. You just follow these steps to find that sweet spot right between the two tendons on your inner wrist and then apply some good, firm pressure. Okay, so we've talked about feeling sick, but what about that other fun symptom? Heartburn. It's so common. So let's see what the evidence says about how to soothe that burning feeling safely. Now, this is a really key difference that a lot of people don't know about. A glass of milk? Sure, it might feel good for a minute. But what can happen is it actually signals your stomach to make more acid later, which leads to this rebound heartburn. On the other hand, calcium carbonate, which is just a natural mineral, it works by directly neutralizing the acid, and the relief tends to last longer. All right, on to section 2, coughs and colds. Since so many of the usual over-the-counter medicines are a no-go during pregnancy, let's look at some gentle, safe things you can do instead. The big takeaway here is that sometimes the simplest things really are the best. A little honey can soothe that scratchy throat, warm liquids keep everything from drying out, and a saltwater gargle can help calm down mild inflammation. Now, none of these are going to cure an infection, but they can make you feel a whole lot more comfortable while your body does its thing. Next up, let's talk about aches, pains, and cramps. Pregnancy can bring on a whole new world of these, from headaches to leg cramps. So how do we manage them safely? For headaches, a lot of the best strategies are really just about getting back to basics. Staying hydrated is huge. Even being just a little dehydrated can be a major trigger. And simple stuff like rest, a compress, and sometimes even the mineral magnesium can make a world of difference. Okay, now this one is a very specific tool for a very specific problem. Clove oil has this natural numbing effect, and it can be a total lifesaver if a toothache hits you in the middle of the night. But, and this is a big but, this is for emergency relief only. All it does is numb the pain. It doesn't fix the problem. You absolutely still need to see a dentist. Ugh, and for those leg cramps that wake you up out of a dead sleep, yeah, those. A combination approach usually works best. Try a little gentle stretching before you go to bed, a warm bath to relax your muscles, and for some people, adding a magnesium supplement, after talking to your provider, of course, can really, really help. All right, I really need your full attention for this next part. This is, without a doubt, the most critical section of our entire explainer. We are going to talk about the supplements and herbs that are not recommended during pregnancy. So the main point here is pretty simple. Pregnancy is not the time to experiment. The risks with certain herbs are real. Some can mess with your hormones or even stimulate uterine contractions. And for a lot of them, we just don't have the safety data to know what they could do to a developing baby. So here are some of the specific ones to really watch out for. You might see these marketed for things like stress relief or hormone balancing. But it doesn't matter how they're described, even if they're called gentle or traditional, these are not considered safe to use when you're pregnant. And here are just a few more really important precautions. Using essential oils in a diffuser is totally different from actually swallowing them, which is a big no. Also, more is not better with vitamins. Your prenatal vitamin is specifically designed to have the right amounts, so please avoid mega dosing anything extra. So as we wrap things up, if there is only one single message that you take away from all of this today, let it be this. Natural remedies are here to support you, to make you more comfortable, but they are partners with your medical care. They absolutely do not replace it. And the final thought I really want to leave you with is this question. Think of this explainer as your starting point for a conversation. It's here to give you the information you need to go work with your medical team so you can have the safest and most comfortable pregnancy possible.